The human body has 206 bones, approximately 300 to 360 joints, and over 600 muscles. Every single day, this system absorbs forces that are several times your body weight, even during simple walking. And here's the interesting part. Most musculoskeletal problems don't start with pain. They start much earlier, with small changes most people don't notice. Once you learn how to spot those signs, anatomy stops being theory and becomes clinical nursing reasoning. If you want to go deeper, the Nursemate Pro digital guidebook breaks these topics down in much greater detail using clear infographics designed to make concepts stick. Let's talk about the musculoskeletal system. When we talk about the musculoskeletal system, we're really talking about three things: bones, joints, and muscles. Bones give structure, joints allow movement, and muscles control that movement. A simple way to remember it is BJM, bones, joints, and muscles. Every movement starts here. We often think of bones as rigid and static. In reality, bones are living tissues. They're vascularized, and they're constantly changing. They have three main roles. The first is support and protection. The skull protects the brain, the ribcage protects the heart and lungs, and the spine protects the spinal cord. The second role is movement. Bones work like levers. On their own, they don't move, but without bones, muscles would have nothing to pull on. The third role is hematopoiesis. Bone marrow produces red blood cells, white blood cells, and platelets. And this is a key NCLEX concept. A major fracture is never just an orthopedic issue. Bone strength depends on three main things: minerals, like calcium and phosphate, collagen, which gives flexibility, and the internal structure that helps distribute load. So when a bone fractures, you don't just lose stability. Posture, balance, and muscle activity all change. Joints are where bones meet and allow motion. There are three main types: fibrous joints, like the skull, that barely move; cartilaginous joints, like the vertebrae, with limited movement; and synovial joints, like the hip, knee, and shoulder, with a wide range of motion. Synovial joints contain three key elements: cartilage, which reduces friction; synovial fluid, which lubricates and nourishes; and ligaments, which provide stability. An easy way to remember this is CSL, cartilage, synovial fluid, and ligaments. Clinically speaking, pain with morning stiffness often points to inflammation. Joint instability points to ligament injury. And limited range of motion isn't always a muscle problem. Muscles make up about 40% of body mass. There are three types: skeletal muscles, which are voluntary; smooth muscles, found in organs; and cardiac muscle, which works automatically. Muscle contraction happens when actin and myosin slide past each other. But this only works if three things are present: a nerve impulse, calcium, and ATP, or energy. A simple memory trick is CAM, calcium activates movement. And here's a crucial NCLEX and clinical point. Muscle weakness isn't always a muscle problem. It can be neurological, electrolyte-related, metabolic, or related to poor perfusion. When something isn't right, the body sends clear signals: muscle or joint pain, swelling and warmth, reduced range of motion, weakness, and joint instability. These are the core elements of a musculoskeletal nursing assessment. Understanding this system allows you to assess strength and mobility using tools like the MRC scale, differentiate muscle pain from joint pain, recognize early inflammation, prevent falls, support rehabilitation, and interpret posture, gait, and function. In other words, every movement a patient makes is already giving you clinical information. If you want clear diagrams, simple mental maps, and clinically solid explanations, check out the Nursemate Pro digital guidebook. If this video helped you, like, subscribe, and turn on notifications. Remember, what you understand today becomes patient safety tomorrow. See you in the next video, future nurse hero.